As researchers try to develop a coronavirus vaccine, studies are being conducted on treatments. At Hackensack University Medical Center in New Jersey, they're looking at a possible treatment manufactured by patients who have recovered from the disease, plasma. Dr. Benjamin Planer is one of those recovered patients. He's also a neonatologist at the hospital. He joins us now. First off, we are glad to hear you beat the virus and have recovered. You tested positive early on. Tell us about the symptoms you experienced.
Right. I tested really early in this whole thing, way back in early March. Turns out my son happened to bring it home from school and then gave it to me and my wife. But thankfully, we got by with pretty mild symptoms compared to some of the other patients that you are seeing and hearing about on TV. So we did not have any fever. We did have some chills, and we had some malaise. We had some muscle tenderness, but we didn't have any fever.
Okay, why did you decide to donate your plasma?
Oh, well, as soon as I heard about the study that Hackensack was doing, it was a no-brainer for us as physicians to want to help further. We knew we would have antibodies. We didn't know what level we would have. I'm talking about myself and my wife.
Right.
We both ended up donating, but it was an absolute no-brainer to be able to help another human being. I don't think there's no higher calling in this world than being able to do that.
You were actually the first COVID-related plasma donor there. Tell us about the study that's going on.
Right. So the study started, I think, in early April, and basically they realized that, they know that there are very few treatments for a viral infection. Patients were really desperately ill in the hospital. I mean, you know what the mortality rate is now. It was very high. Patients were dying, and the physicians in the front line really had very few options to treat these patients. And so one of the therapies that they came up with was to use convalescent serum or convalescent plasma. And the study that they designed was to make sure that we were well after the illness, that we were symptom-free, that we tested negative at that point, and that we had decent antibody levels within our blood. So we went in for the testing it was about 3 weeks after we were ill, after we recovered, and we tested negative. Turns out my antibody levels were super high, which was nice to hear. And then the following day, just before the Passover, Easter holiday, I went in and I donated the plasma.
Wow, that's great. And it's a pretty promising treatment then right now for people who have coronavirus.
It is very promising, although there's no data that's actually been published to date to show that it makes a difference. But the word on the street is that it is helping patients, and that it's an excellent therapy for these patients.
Wonderful. Dr. Benjamin Planer, thanks so much for the information, and stay healthy.
Thank you very much.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.